Welcome back. If you are one of the millions of people looking for a minimally invasive option for treating chronic pain, there is a solution. And here to explain are Dr. Paul Lynch and Tori McJunkin from Arizona Pain Specialists. It's good to see you. Thanks for both being here.
Thanks for having us.
So many people suffer, especially from lower chronic back pain. Tell us about what you do for folks.
Thanks for having us on, Lisa. And I think it's really important that people engage in things like yoga and other things to prevent back pain from occurring. But when you have back pain, what do you do?
Right.
And I think that's where we come in. We're interventional pain management doctors. Both of us went to medical school, anesthesiology training, and then both of us did specialized training in interventional pain management. We're both board certified and fellowship trained. I think Dr. Lynch is going to talk a little bit more.
The interesting thing about Dr. McJunkin and our practice is we're young, we're very idealistic. Dr. McJunkin and I have been best friends actually since we were in college. We were on the same floor when we were freshmen. And ever since the early days, we used to talk about what kind of medical practice would we run. And we talk about not just medications, not just injections, but an entire comprehensive package. If a patient comes to our clinic, we've been blessed enough to have a beautiful 14,000 square foot facility that we work out of. We have in-house imaging, we have physical therapy, we have a chiropractor, even a naturopathic doctor, and we even get to work with our own fathers. My dad's a therapist who does biofeedback and relaxation training, and Dr. McJunkin's father is a naturopath. So we really we do a comprehensive approach to pain to try to get to the source.
And it's all right there under one roof. You can get a lot of the things.
And that's really wonderful for a lot of patients because they will go from place to place.
Yes.
And one option doesn't always work, but if we can surround the patient with a lot of options, we oftentimes will get very good results.
Now, what kind of symptoms does a person need to have before they can call you? I mean, is it just somebody who's been suffering for a year, or maybe somebody who's only been suffering for, they don't know where to start?
That's a good question. What we try to talk about, and if you look at the literature, the earlier you intervene in a pain syndrome, the better outcomes you have. So for example, if you can get someone in the first 90 days after a back injury, you have such a better chance of having a good outcome versus waiting a year with that kind of pain.
Have you found people who pull their back, they feel a little bit better after a while and they let it go, but that seems to keep coming back to haunt you if you don't really fix it correctly?
That's exactly right. And sometimes pain can do that where it snowballs more and more out of control. And I think what Dr. Lynch was saying, early intervention is really important. And the intervention that you choose to use is really based on what diagnosis do they have. Right. Do they have a bulging disc? Do they have a herniated disc? Do they have Facet syndrome? There are so many different things that could be causing their pain, and we really want to give them a comprehensive evaluation and figure out exactly what's causing their pain.
If you talk about like a herniated disc, that's what everyone's dealt with that. Either they've had a herniated disc, they have a family member. The old paradigm is they would go to their primary care physician who would say, you have a herniated disc, I'm going to send you for surgery.
Right.
And there's nothing wrong with that, but there was a special on television last week that said, they actually had a neurosurgeon saying, only about 50% of people are going to get relief if we do surgery. So we've tried to set up a practice that we want to send our own parents to, that will come in, we'll sit down, we'll give you common sense solutions, we'll give you kind of the gambit of treatments. We can start with physical therapy, with yoga, with diet, with exercise, with ergonomic training to change the way you sit and stand and walk. And then if that doesn't work, we have other minimally invasive options that can get people back to work without surgery.
Right, so it sounds like you have little treatments for just about anybody going through any sort of, especially back pain, but I know you treat other kind of pains as well.
That's exactly right, and last time we were on the show, we had somebody who had facial pain, and she'd had it for over 10 years, and we treat people with neck pain, back pain, foot pain, leg pain, so we will really treat anyone who has chronic pain, and we like to see someone early, but we also see patients who have had chronic pain for 10 years and haven't found any relief. And there is new technologies, there's pacemakers for pain management that we're using now.
Wow.
Which maybe we'll talk about more in the future, but there's some exciting options that we have that were never available just 10 years ago.
And that's the exciting thing. When we first decided to go into pain management, we were actually on two different paths, even though we were best friends. I was going to go into psychiatry, Dr. McJunkin was going to be an emergency medicine physician, and then one of our family members got sick and we started looking into pain treatments, and you would not believe all the options that are out there, from radio frequency ablation of nerves that cause pain to spinal cord stimulators, which we call pacemakers for pain. We can actually put electrodes into the epidural space to try to block pain, to even fixing fractures with small needles with x-ray guidance in the spine. It's just such a different world today.
What I like is that it's all there in one spot. That's amazing. amazing, all these different treatments that you can have available to you. Thank you very much.
Thank
Very
you.
good news. So if you are one of those people, I know there's so many people who suffer from that lower back pain, they're popping Motrins every day. Don't do it. Go get it looked at. And if you want more information about Arizona Pain Specialists, go to arizonapain.com or call the number you see right there on your screen.